she really wanted to come today, but I figured it would be best if she's outside.
That's not a problem. Just give me a second. I'll tell Krista to keep an eye on her.
Okay, thank you.
So I'm going to give you this information first, and it has a whole bunch of information about the fit and fissure procedures that we are going to discuss today.
Okay.
So she's in good hands. She's with Krista.
Okay.
So has Lily had any sealants before?
No, she never has. Could you tell me a little bit about it?
Of course. Dental sealants are a clear protective coating that can easily be applied, and it won't be invasive at all. It covers the tooth surface, preventing bacteria and food particles from settling into the pits and grooves of the teeth. Although fluoride causes the overall rate of caries to decrease in dentistry, it's a greater benefit to have the pit and fissures because it has a smooth surface, and the pit and fissures on the teeth do not benefit from the effects of fluoride as much, and the enamel surface. Properly placed sealants have 100% effectiveness on the caries rate.
That sounds great. What are the indications and contraindications?
So the indications are as follows. Deep retentive pits and fissures. Clients have a high risk of caries, which just because she's younger, she might, based on her diet. And the client is suffering from severe dry mouth, which she doesn't obviously have. The client's undergoing ortho, which she doesn't have presently, but she could potentially have it later, and which would cause decalcification because of lack of brushing around the area. This is why we would put a dental sealant on Lily. If the client is uncooperative, the tooth is not fully erupted, which her teeth are. If there's dental caries on it at present, so dental cavities, this could also be seen by X-ray interpretation. Another few contraindications would be if there were pits and grooves that are well coincided and they're self-cleansed. And lastly, if the tooth expectancy is limited, but that's on her permanent tooth, so it'll be okay.
Okay. How much does something like that cost?
Roughly,
is it covered by my insurance?
Roughly, a pit and fissure sealant would cost about $40, but we can have Krista check up at the front, and she'll send it out to your insurance plan to see if it's covered for Lily.
Okay, that sounds reasonable. What are the advantages of the procedure?
Now, ma'am, there are many advantages to this procedure. It is relatively cheap in cost. It's much less expensive than the alternative options, which if she doesn't have it filled, then she can have a cavity, and maybe she might have to get her tooth pulled. It can be prepared in a single appointment, which is great because young kids have a lot on the go, and of course you do too. If properly applied, the sealants are very effective in preventing decay in the pits and fissures, which are common areas, and even early decay appears to stop when covered by a sealant, because decay-causing bacteria are unable to survive when cut off from the food supply. A properly placed dental sealant will last for as long as the typical amalgam filling would, so that really varies from person to person. Even if the sealant is damaged or lost, it is easy to replace. The sealants are also safe on the use of everyone's teeth and for young children and adults. In addition, it is an effective preventive measure. Sealants, and they cost less than the cavity filling.
Okay. Yeah. So, what are the disadvantages of the procedure, and what factors might affect the procedure?
Well, because the material is placed on the tooth, there's always the chance that too much sealant material could be placed, which in that case, the tooth would just hit too high. So, but if that were to occur, we would easily fix it. Some factors that would affect the procedure are moisture contamination, but if we isolate it properly, it would be fine. And that's the primary cause of failure because of the retention, and inadequate etching is also a factor because then that is the loss of sealant retention as well.
Okay. Are there any other options for Lily?
Well, ma'am, there are There are, but in her case, I truly do believe that the sealant is the right choice. The other options would be to apply fluoride to remineralize the area, or just not to apply a sealant at all. But in that case, most likely Lily would develop a cavity at some point in her life, and that would be much more expensive to repair than the sealant. And also her tooth structure might have to be removed because of excessive decay.
Yeah.
Therefore, I really do believe like a sealant is a good option for her.
Okay, and I think the pit and fissure sealants are the best idea.
Typically, if the pit and fissure sealants are placed properly, they can last 5 to 10 years, and it is not uncommon for them to last longer than that.
Okay, and how long does the procedure take?
I've prepared a slideshow outlining the whole procedures for you. It normally takes 10 minutes per tooth to apply the sealant, so that's not long at all. Lily should be able to sit for that long. This slideshow shows you how I will be putting them on Lily's teeth. Lily Dodds is an 8-year-old little girl. She has spots of demineralization on tooth 3-6 and 4-6. It is suggested that she gets a pit and fissure sealants done to try to protect these areas from future decay. Lily is in the reception area while Mrs. Dodds and Christine, the dental hygienist, discuss the procedures further. Steps and procedures to a dental sealant. First, the tooth will be polished with pumice and rinsed thoroughly. Next, it will be isolated with cotton rolls and dried completely. The etchant will be used on the tooth surface and left for 20 to 30 seconds. Be rinsed off and dried once again. Next, the sealant material will be placed on the tooth surface. The dental sealant will be cured with a light for 30 seconds and then checked with instruments to guarantee that it is firmly sealed. Once that is done, we will check the bite registration to make sure that it is not hitting too high. Lastly, the dental sealants can last from 5 to 10 years.
Will there be any pain during or after the procedure?
During or after the procedure, Lily won't feel any pain. As I said, it's just a thin lining that fills the pits and the grooves of Lily's teeth to prevent decay from occurring, so she wouldn't even need to have anesthetic.
Okay.
So you see, ma'am, this is the procedure I'd most likely suggest in the case of Lily because it's not that extensive.
Okay, well, thank you, Christine. That all makes sense to me now. I will go up and book an appointment for Lily at the front desk.
Okay, have a good day.
Thank you, you too.